Okay, what we're going to do is we're going to start out assessing one of the phalange joints. So we're going to assess his metatarsal. We're going to do it on the right foot. We're going to assess his metatarsal phalange joint. We're going to take it through 5 different motions. The first one we're going to do is going to be an A to P shear. Next one we're going to do is medial to lateral shear. Next one's going to be a medial to lateral tilt. Next one will be rotation. And the last one will be distraction. Okay, from there we're going to move into the pronation protocol, and what we're going to do is we're going to start out with some muscle tests. First muscle test that we're going to assess on his left leg is going to be the glute med test. This one tests for the cuboid. So come here, turn it over, don't let me press in. Okay. Next test we're going to do is the psoas muscle. So for this one, okay, there we go. Don't let me press down. Okay. And the last one, maybe bend both these knees, will be the test for the quad. Don't let me press down. Okay. And now the quad test was assessing the metatarsal heads. Finding all of those to be a grade 4 or less, we're going to go ahead and go through the pronation protocol. So what we're going to start out with is the navicular. Navicular sublates inferior and medial. So we're going to correct it superior and lateral. Next is going to be the cuboid. Subluxate superior and lateral. Correction inferior and medial. Next one is going to be the cuneiforms. Now this one subluxates inferior and superior, or inferior. So our correction is going to be superior. Next one's going to be our met heads. This is our ooh-ah adjustment. Next one's going to be the talus. This one subluxates mostly anterior, slightly lateral. Okay. Next one is calcaneus. And so we're going to rotate it about 3 or 4 times. One direction, 3 or 4 times. The next direction. Next we have our phalanges. Got it. Yes. From there we're going to move on to the fib head. Let's see here. Okay, tissue slack lateral to medial. This foot's only going to be about 2 or 3 inches off the ground. A to P, just like that. Okay? Now what we're going to do is we're going to retest all those muscle tests. So again, we're going to start with the glute med test. Right here. Don't let me press in. Excellent. Psoas. Don't let me push down. Strong as an ox. Next. Move to the quads. Don't let me push down. Excellent. Grade 5 on all of those, so excellent adjustments on my part. Next, we're going to move on to the supination protocol. So again, we would run through the same muscle test for this, so we'll just do it real quick. I'm going to go through the glute med. Don't let me push in. Okay. Psoas, don't let me push down. Okay. And let's lift these, bend these knees. Quad, don't let me push down. Okay. So finding those to be a grade 4 or less, we're going to go through the supination protocol. So we'll start out with the navicular. This one subluxates superior and lateral. So the line of correction is going to be an inferior medial. Next one we're going to do is the cuboid. And this one is the exact same as pronation. Next we move into our met heads, pressing on the top this time. Again, this is our ooh-ah adjustment. Next we do the talus. This time our outside hand is going to be on top. And this subluxate's mostly lateral and slightly anterior. Calcaneus. Same motion as in pronation protocol, except I'm holding it with my inside hand this time as opposed to my outside hand. From there we did phalanges again. Okay, and now we'll go into the fibular head, which is the exact same. Right, lateral to medial tissue slack. A to P, just like that. So real quick, again, we're going to reassess these muscle tests. Only push in. Okay, that's for the glute med. Don't let me push down. It's for the psoas. And bend your knees like this for me. And the final one for the quad. Don't let me push down. Okay, found all of those to be a grade 5. Okay, now what we're going to do is we're going to assess the knee joint. So I'm going to start out assessing this right knee. I'm going to make sure he's in full extension. Okay, he is. I'm going to come out just a little bit more that way. And now I'm going to press, feeling for movement. Okay, feel a little bit of movement with the lateral, on the lateral side. Go ahead and flip over for me, Patrick. Okay, now what we're going to do is we're going to do the wrist extension adjustment on his knee. We're going to start out with on the medial condyle. So I'm coming here, I'm going to palpate the medial condyle. In here. Okay, make my V. Okay. Now we're going to come to the lateral condyle. Same thing. Okay. That was for the medial condyle and the lateral condyle. And then in a posterior tib adjustment, what you do is you would start out with the medial and then the lateral. So I'm going to perform that again real quick. Okay. Go ahead and flip back over for me, please. Okay, so I'm going to recheck this knee. Okay. Feels pretty good, but we're going to use the other type of adjustment, the prone leg flex. So go ahead and flip over for me, Patrick. Okay. Okay, now with this one, again, we're going to start out on the medial condyle. Coming in on the medial condyle with my lateral aspect, my pinky, medial to lateral tissue pull. Okay. Lateral condyle, my lateral hand, lateral to medial tissue pull. Okay. Go ahead and flip back over for me, Patrick. Okay. So that was the knee. That was the knee, and now we're going to move on to the hip. So we're going to start out with the rectus femoris test. So we will do, is it this leg? Let's do this leg. Don't let me push down. Grade 4, very weak. So now we're going to, you're not going to be able to see that. So we're going to do this one real quick. Let's test this guy. Don't let me push down. Weak. Okay. So for this adjustment, we're going to find the greater trochanter and the medial aspect here. There it is. Okay. Same motion as the what we did in the posterior knee. So here we go. Okay. And now what we will do is we'll retest. Hold it right there. Don't let me push down. Look at that. Excellent adjustment. Okay, alternate toes. Okay, now what we're going to do is we're going to get into some of our alternate adjustments. So we're going to start out with the hip ones. So let's try the tensor fascia latte. So that's the one here. Don't let me push in. Okay. And then from there, anterior femur, that's what it is. Okay. So we're going to come in here. Just going around the acetabular joint, feeling for some restrictions. So right about in there feels a little restricted. Okay. Okay, now we will assess our internal and external rotation. So, sorry, first guy here, like this. We'll rotate him out. Okay, that was an internal and external rotation assessment. We did that. Now what we're going to do is we'll assess his patella. This one we'll just do his right patella. And so we're going to go check it lateral, and medial, and inferior, and superior. And his patella seems to move well in all those directions. So after that, move on to our great toe technique. Let's see, back up a little bit for me, if you can, Patrick. Perfect. And we'll just switch this guy down a little bit like that. Money, okay. Now we're going to do our great toe adjustment, and you have to do it in both joints. First off, it's going to be the metatarsal phalange joint, and then the next one will be the interphalange joint. Okay. And then from there, we're going to move into our alternate talus adjustment. So go ahead and flip over for me, please. Let's see here. Yeah, we'll do this one. So this one is going to be the prone knee flex that we're going to start out with. We're going to come up here to the base of the calcaneus. Let's see, is it like, it's like this. Like that. Okay, what I'm going to do now is I'm going to start out with the bunion adjustment. Come in here. Okay, now we're going to move on to the alternate talus ones. So let's see, Patrick, can you... No, you're good right there. Go ahead and flip over for me, please. Speed. Okay. Okay, and those are the alternate talus adjustments.